are you?
Good. How are you?
I'm jealous of the weather that you're around, apparently.
Yes, California.
Oh, where in Cali are you?
Southern California.
I went to UC
Rancho.
Irvine.
Yeah, it was pouring down raining yesterday. And it was like 35 degrees last night, and then now the sun is out today.
Yeah, it was bad here in Vegas too. So thank you for the birthday wishes. So yeah. So what course were you in?
I took the course. It ended last month around the 13th. I did your 15-day course, the on demand.
Right.
Yeah.
And so you did just the on demand for 15 days.
Mhm.
Okay, and did you, or this was your, what attempt was this for you?
It was my second attempt.
Second attempt, and all you needed was a 15-day on-demand course. That's amazing. And
Yes.
then what's it called? How many questions were you?
I got the whole 145.
Whole 145. It's okay. It's a pass is a pass.
Yeah.
So you're
Yeah.
gonna be working in SoCal?
Yes, I
Oh,
am.
okay. And have you
I'm
decided what?
I don't know, Dr. Z. I got 3 offers so far, and then I have 2 more interviews this Friday with 2 major hospitals. So I don't know. I've
I
been
mean,
getting mental health offers
okay.
and med surg.
Oh, nice. There's
Yeah.
a lot of demand. Look, that's five job
Mm-hmm.
actually opportunities right there. So
Yeah.
nice, very nice. And what would your advice be to people on the other side?
Listen to what Dr. Z says. I mean, he's amazing. I use the method on every question. I got a Kawasaki and aspirin question. And
Oh, wow.
I remember hearing your voice, and I was like, Dr. Z said this, so let me choose that. And
There you
I
go.
stuck to what you said. I used the method axe graph, and obviously I did good. I passed.
Yeah, 145 and out. I love it. I love it. I love it. Yeah. It's kind of interesting because one of our interns, she passed, and she was like, literally, she's like everything I saw was in your course. And I was just like, wow. I was like, we're doing something right. We're doing something right.
It
So
was.
that's amazing. That's amazing. So Ask Graph, using the method, and listen to those lectures for 15 days.
Hmm.
How much time did you spend, just for those, so people know, as far as, like, what was your schedule like with the 15-day on demand? Because that's kind of a condensed course then.
It is. It went by really fast. I have 2 children. I have an 8-year-old and a 3-year-old. I work full time. So what I did was I just did the content first. I took all notes. My friend Sade, you interviewed her a few weeks ago.
Yeah.
Yeah, she was the 3rd-time test taker. So I did all of the notes, and then every day after the 15 days, I reviewed the notes, and then I did questions.
Wow. Okay. So your method was, let me get to and I kind of, I like that. I like that
Mhm.
methodology as well too. That let me get what's the point of looking at questions if you don't know the content,
Right,
right? You know,
right.
so that 15 days you just did straight content, and you
Hmm.
felt that that was enough. 15 days.
Hmm. And then on day 16, I just reviewed one area, and then I did questions on that. And cardio was pretty big. So
Yeah.
I started off with cardio. I read all the notes, and then I did practice questions. I was like, Dr. Z and these questions, but it worked. It worked.
Yeah, and it's that application that I love the most.
Hmm.
Is it's great if you have content, but you need to be able to apply it to questions, because that's what you're
Yes,
gonna do on test day.
yes.
So,
And you know
well,
what, Dr.
but
Z, another thing that stuck in my NCLEX, I remember with CHF, you said always know it's left, and unless they specify that it's right. And I got a right side, and I'm like, Dr. Z said,
yeah.
so I mean, what he says, you really need to apply what he says. He knows what he's talking about.
Oh, well, thank you for the kind words. I do appreciate that. Well, Sade, we congratulate you. You used just the on demand, and you followed the method and Ask Graph. And here we are, second attempt, 145 questions, and out with 5 job offers. You can pick and choose
Yes.
whatever you want. You can pick and choose whatever you
Yeah.
want. That's awesome.
Yeah.
And you had 2 kids, and you worked full time.
Mm-hmm.
I mean,
I think I have to.
you
It's worth the money, Dr. Z. You're amazing. Your
thank
whole
you.
plan, just stick to it, and everyone will be fine.